Hi there, welcome to Doc Talk. As you remember, this is where we talk about medical conditions in plain language. I welcome you. I'm Elise Denaney, former president of the Knoxville Academy of Medicine, sponsor of Doc Talk. And I'm so glad to welcome today to our podcast Dr. Ben Wilkinson, who is a radiation therapist located at Provision Center for Proton Therapy. That's going to take a lot of time. That may take up our whole 15 minutes just to understand what that is. Welcome, Ben. So glad you could join us today.
Thank you for the invitation.
Tell me, what is proton therapy?
So proton therapy is one of the types of radiation that we use to treat cancer. If you think about cancer in general, there's three main specialties: surgery, systemic therapy or chemotherapy, and then radiation. So radiation can either come in the form of implantable radiation, or what most patients see are radiation that comes from a machine outside the body. So proton therapy is one of those types of machines.
Okay. We have patients all the time who unfortunately have that horrible diagnosis of having cancer, the lung, the breast, the prostate. And it's so nice to know that we use different modalities to attack and win the battle against cancer. So radiation therapy, is that the same as proton therapy?
They are. So proton therapy is a form of ionizing radiation. It's just how we deliver it. So an X-ray, most people have had chest X-rays before, where the source of the radiation is in front of them, the film or the digital cassette's behind them, and that X-ray goes all the way through the chest, and we want to see what's happening inside the bones, the heart, the lungs. When we treat a cancer, we can use X-rays in a similar form, just a higher energy. The potential downside is that that X-ray energy, just like a chest X-ray, it continues to travel all the way through the patient. And so if you're treating in a critical part of the body, you mentioned lung cancer. So if the lung cancer is next to the heart, that means that not only the lung cancer gets the radiation, but also the heart does as well. So proton therapy, since it's not an energy wave, it's an actual physical particle. It travels to a set distance in the body, depending on how much energy, or what we tell the computer, how much energy we give it, delivers its energy, and then it stops. So within a few millimeters of where we point a proton beam, we can guarantee that there's not additional radiation dose on the other side of where we pointed that beam.
So it's like a target, right? So you're trying to plant something that's going to implode and destroy the cancer cells, but not destroy any of the surrounding tissue.
It still has to have an entrance path, and so I think that's important to say, is that where the beam comes through, there's still going to be some radiation dose, but what we're able to do is decrease that dose with the type of technology we have here in Knoxville. It's called pencil beam scanning, and then limit that additional radiation dose on the other side of the target.
So less radiation dose to areas that you don't want to impact with radiation is one of its advantages. Does it have a shorter time frame?
It can. So when you deliver radiation, one of the things you worry about is that extra radiation dose that's going to the surrounding tissues. And when you're able to limit that, there are times where we can shorten the radiation course by giving a little bit of a higher dose. And it's a concept called hypofractionation, or shorter course therapy. And there's a lot of interest in this, just especially in our part of the state, because we have a lot of patients that drive extended distances to come in for treatment. So if we can take a 6 or 8 week course of treatment and condense that down to 4 weeks, or sometimes even 2 weeks, then that's a significant benefit for both the patient and the family, as well as the cost, because the cost of treatment tends to be per treatment for an insurance company or for Medicare.
Yeah, not to mention them staying at a hotel and the cost of transportation and food and lodging and all of that, it builds up. Okay, so proton therapy, is it applicable to all different parts of cancers in the body, or is there certain areas that it's more ideally suited for?
Yeah, so there's definitely certain types of cancer that we don't use radiation for. So leukemias, there's certain cancers that have spread to multiple parts of the body that we wouldn't use radiation of any type for, that the best therapy might be a chemotherapy or targeted therapy. But once or some of the other physicians have mentioned that radiation might be part of a care plan, that's where we start thinking, would proton therapy be one of the options? And in general, as long as a tumor is not incredibly small or something that moves with respiratory motion, we would say that proton therapy may be an option. And so we would want the chance to do what we call a rival plan or a comparative plan that uses regular radiation and then protons, and then you can compare those side by side and see if there's a difference.
Okay. If a patient was considering proton therapy, does insurance generally cover for proton therapy?
There are certain types of cancers that proton therapy is universally covered. That's pediatrics. So we know that children, unfortunately, are diagnosed with cancer, and we expect them to live a very long time, so they can live out some of the side effects of regular radiation. We also know there's certain types of base of skull tumors called chordomas that have been proven that there's a better outcome. Beyond that, we start to get into where the disease is located. So if it's left-sided breast cancer, for example, we know that that's close to the heart. We know that if someone has a brain tumor that's close to some of the critical internal parts of the brain, like the hippocampus or the pituitary gland, that there would be scenarios where proton therapy would be covered. And that's in the commercial insurance space. For Medicare, Medicare has covered proton therapy for now 20 years, since the late 1990s. And that's definitely a blessing, is that patients who need proton therapy that at least have Medicare have coverage and access to proton therapy.
That's good to know. So, for example, if I was a cancer patient and was going to have surgery and then radiation therapy, and sometimes people do radiation therapy before the surgery, some people do it after the surgery. That's where everybody kind of gets together as a team and decides what's best for you as an individual. Do they come and visit with you, and then you tell them the risks and all of that? Like, what would the risks be? Would they be the same as radiation therapy?
Yeah, so we are very comprehensive, and we work with other physicians, including multidisciplinary tumor conferences that we have at Provision, but also at other affiliated institutions like KCBC, which is there at the Dallas Springs campus as well. And when a patient comes in, because we treat both with regular radiation and protons at Provision, we talk about all the options. So we go through what the risks might be with both. And the best way to describe it is that the risks are really similar between them. So the chance and the type of side effects that you're going to get, it's just how often that side effect shows up is going to be less with proton therapy, and potentially the incidence or the intensity of that side effect is going to be less. So if you were to look at prostate cancer, for example, prospective data has shown that the bowel urgency and frequency after treatment is less with proton therapy. It's not zero, but because you've had less radiation dose to the rectum, you're going to have fewer problems afterwards, or at least a lower chance of having those side effects.
I know that radiation causes inflammation, and so you almost feel like you have a sunburn. And I know people all the time who get radiation to the head and neck area get a whopping sore throat. Mm-hmm. So maybe the intensity might be just a little bit less.
And it depends where we treat. So as you know, there's certain types of head and neck cancer where we only have to treat one half of the neck, so ipsilateral treatment. And in those cases where we have these really well lateralized or cancers that are over to one side of the body, that's really where proton therapy can shine, because we can treat just that one side and then there's literally zero dose on the other side. When you do your exam and you look inside the patient's mouth, you can actually sometimes see a line of mucositis where we're treating the one side and we need to do that to cure the cancer, but then you can see the other healthy side that does not have an effect.
You specialize in certain areas. Which ones are those?
So prostate cancer, breast cancer, brain tumors, and then pediatrics. So when we have children here in the East Tennessee area.
Okay, so breast cancer, we see a lot of breast cancer. And proton therapy then can be targeted to both right and left, both at the same time?
It can. So there are women, just saw a patient today that had bilateral breast cancer. That's fairly rare, but it is something that can happen. And so when we are treating both breasts, we know that the amount of lung tissue and heart tissue that would be exposed to radiation is going to be higher. Where we think proton therapy has a specific role is when we have to treat lymph nodes. There are lymph node chains called the internal mammary lymph nodes that go right next to the sternum or the breastbone. And the heart, especially on the left side, but also even the right coronary system is close to the internal mammary lymph nodes on the right. And so when a physician, a surgeon, for example, says, that they found lymph nodes at the time of surgery and that extra treatment is going to be needed after surgery, maybe chemotherapy or radiation, that's where we start to think about, could proton therapy decrease the dose to the heart?
Precisely, and it's so amazing. We talk more and more, I think, as a healthcare system, we understand how important quality of life is. I know I want to be able to taste my food. I want to be able to swallow without pain. Mm-hmm. I want to be able to have a certain level of energy, and if all the treatment's going to hamper that, then I want to be able to make that choice.
It comes up in conversation. I'm friends with a cardiologist at the University of Tennessee, and I ask him, I say, how do you handle heart problems after cancer therapy? And his perspective is, well, do what you need to do to cure the cancer, and then we'll take care of the rest. And the discussion, continues, and we say, well, what if you didn't have to take care of the rest? What if we could, prevent having those heart problems? And that we're really trying to eliminate one of the reasons people have heart attacks or pericarditis afterwards, valve problems, that could lead to longer non-cancer related lifespan.
Right. Quality of life is so important. If a person was told that they needed IMRT, which is traditional radiation therapy, and they were interested in proton therapy, how could they go about investigating that on their own?
So there's a lot of good websites that talk about this. I generally tell patients to stick to the .gov and the .edu sites, okay, as opposed to maybe the blogs at first, just because you can get a lot of good information. There are books as well, so depending on which areas of prostate cancer, for example, there's several good resources. Protonbob.com is one that we emphasize.
I've heard of that one.
Yeah, it stands for a gentleman named Bob Marchini that went through proton therapy, and his brother went through prostatectomy. But it also stands for his organization, Brotherhood of the Balloon. And so it's this online support group that they've got thousands of men that look at prostate cancer. But I would say that if it's specific to a family member or personally, that calling our center or visiting our website is probably the best thing to do. We can always do a review of a case without even a patient coming in, and so we can review records and determine if there could be a benefit. We can sometimes even do a rival plan even without a patient coming in. So if there's a timeliness aspect of trying to make a decision within days, for example, before starting, there's ways to do that. Some of the surrounding radiation oncologists will send us cases, and we can do that for them and then determine if a referral is appropriate or not. But I think really making the step to learn and go on the website and then call. There's several people at Provision that can help walk a patient through the process and come in. And I just had a patient yesterday that said, well, I'd already talked to a former patient for an hour, and I didn't think I needed to come in for a consult. But he said, I'm really glad that I did. I learned a lot in the process.
Yeah, and Proton Therapy is the only proton therapy center within a radius of
at least 2.5, 3 hours. So for a long time, it was just us in Jacksonville, Florida. What's neat about Provision is we're building proton equipment as well here. And so we have a factory by the airport. So we've installed a second location in Nashville that has now started treating prostate cancer. And we're building a third location in Orlando. Our fourth one will be with Duke University. And so there's a lot of exciting things that are happening. But if someone's in East Tennessee or in North Carolina, South Carolina, Kentucky, we're really the option for them to be able to drive.
That is great. Okay, so going back to our area here, we're doing side-by-side plans. They can mail things in if they need to, if they can't make that trip in. With proton therapy, is the time off required from work? I mean, they do the 4 weeks or 6 weeks, and then they go right back to work.
A lot of people continue to work during their treatment, so it depends on the site. As you know, head and neck cancer is a lot more difficult to get through than potentially prostate cancer or early stage breast cancer. But if someone is off of work for that time, we would expect that, if not right at the end, within a few weeks, they would be able to go back to work.
Okay. And I know that even if their insurance plan says we don't cover for proton therapy, that's not a closed door. You mentioned the .gov websites, so I know that you have some legislative activity to help patients with getting proton coverage.
Yeah. So I would say that if we think that there's going to be a potential issue with insurance, the best thing to do is to come in, have the consult, let's do the rival plan and present the options to the insurance company, because sometimes we can make a clinical case. We have things as, peer-to-peer discussions with other physicians,
Right.
and we can make a case and say this is why, and many times we are able to convince an insurance company that initially said no, that does say yes once they see the difference and see the plans. From a government perspective, we are going through a legislative process where we're hopeful to have coverage for state employees, and so that's the current bill that is being explored. But we'd like to expand that to all patients, and so that potentially the difference, the cost maybe between IMRT and proton therapy might be the only difference that a patient might have to pay.
I'm so glad that you're here in Knoxville. I'm so glad that patients in the East Tennessee region have that option to investigate if proton beam therapy might give them better quality of life in the outcome, because they're battling something very, very difficult to begin with. So if a patient wanted to get to access your website or call you for an appointment, how do they do that?
So provisionproton.com.
Provisionproton.com, okay?
Or our phone number locally is 865-862-1600, and they would ask for one of our care coordinators or just say they're a potential new patient, and they'd be able to help them from there.
That's terrific. Any final words that you'd like to say on, tell our people in plain language about proton therapy?
People are really surprised to hear that large cities like San Francisco, Austin, Texas, New Orleans, Kansas City, Denver, they don't have proton therapy, and that it's the heritage of Oak Ridge, University of Tennessee that really led to development of the PET scan here that led to us having proton therapy. And so we were here before Atlanta had their proton center, before Nashville did. So I think it's really a testament to our area, and it's a great resource. And it's not right for everyone, but I think it's good to know that it's here, and for patients to investigate or family members to investigate all options.
Well, I thank you today for your candor, for your honesty, and for helping patients. Really appreciate that. So there you have it, Dr. Ben Wilkinson from the Provision Center for Proton Therapy. As you know how to get a hold of them if you wish to, and I hope that you learned something today from our podcast called Doc Talks. And that's a wrap.